New at 11 tonight, we have some North State health news. A cardiac surgeon in Reading is worried that specialty doctors like himself may soon dry up nationwide. Dr. Doug McConnell says data from the American Board of Thoracic Surgery shows that 30% of the programs nationwide have no applicants. This as the demand for heart procedures goes up. And he told me if something doesn't change, the problem is only going to get worse.
Surgeons, we go inside and fix things.
As director of cardiac surgery at Shasta Regional Medical Center, it's Dr. Doug McConnell's job to fix the human heart. But now he's trying to fix a problem outside of the surgery room, a problem that he says is damaging the heart of his profession.
You may well have a shortage of well-trained individuals in these very important fields as time goes by.
According to the Centers for Disease Control, 1 in every 4 deaths in the United States is heart disease related, and it's also the leading killer of both men and women. So why are so few people joining this profession if demand would seem so high? Well, Dr. McConnell says it's a two-part answer that comes down to one thing: money.
People say, well, there's no jobs in cardiac surgery because there's no apprentice roles out there.
Dr. McConnell, like many other surgeons, will hire apprentices who will get the proper training needed to receive their surgery credential. But Dr. McConnell says Medicare payments from 1996 to now have been cut by more than 50%, and that ties up cash that's needed to pay them.
Consequently, you don't have jobs at the end of the residencies. Consequently, you don't have applicants who are going to go down that road.
The cuts in Medicare reimbursements also affects the amount of pay that surgeons take home.
The government has decreed that I will make less money. I mean, a cardiac surgeon will do an aortic valve and take 4 to 5 hours in the operating room, will make less money than the podiatrist doing bunions. And that's sort of insulting as well as the truth.
McConnell says fewer surgeons could have serious implications, especially for patients in rural areas like the North State.
So in a rural area, you have a population of patients, but you may have enough demand for 1 or 2 cardiac surgeons. But if one leaves or retires, then you've just lost 50% of your access.
And the doctor also told me that demand for cardiothoracic surgeons is nowhere near its peak because the baby boom generation has not even hit the demographic at this point. But